Washington.
Well, it's no secret that the COVID pandemic has taken a toll on the mental health of millions of people. But for those suffering from pre-existing anxiety disorders, it may be even more complicated. Here to help shed some light on anxiety disorders is Dr. Scott Hannan, a psychologist and program manager at the Anxiety Disorders Center at Hartford Healthcare's Institute of Living. Welcome. Thanks for being with us.
Thanks for having me.
What kind of impact has COVID had on anxiety disorders?
Well, I think about really three main impacts. First of all, our bodies are designed to handle stress in short-term periods. With the pandemic, this has been going on for a full year. So long-term stressors can lead to higher anxiety, depression, sleep problems, and gastrointestinal problems. So for our patients with anxiety disorders who are already have an overactive stress response, this is going to be more difficult. And the normal coping tools may not be there. So socializing, getting to the gym to work out. For some of our clients, we also see just an increase in anxiety, just the triggers, right? Worried about their own health, worried about the health of others. Now we have a pandemic. Or just some of the responses to it, or, if I have social anxiety, I've got to do all these meetings online, on camera, which may be really difficult for me to do.
Wow, that is so true. All right, what are some common anxiety disorders?
Some of the common anxiety disorders that we see are like generalized anxiety disorder, where you have excessive worry about maybe typical things of the day or your future people in your life. We see social anxiety, where people are worried about just embarrassing themselves in front of other people. You have panic disorder, which is a condition where you worry about the physiological symptoms of anxiety. Specific phobias, we're worried about things like animals, heights. We have people that worried about throwing up, people worried about blood, which these can be very disabling and very impairing. And going along with anxiety, we also have things like obsessive compulsive disorder and post-traumatic stress disorder.
All right, how can family and friends support a loved one who suffers from an anxiety disorder?
Well, I think the first thing to think about is what they're experiencing internally is very real. Even though we can look at the anxiety and say, your fear is out of proportion to what we need to worry about, internally their body's responding as if this fear is very real. And so we have to understand that and help them to get to the proper treatment. So one of the most effective treatments for anxiety disorders is cognitive behavioral therapy, where we help people to learn how to change the way they think, but also how to confront that fear. So their brain changes the response. So when they're faced with that situation, they don't feel that intense anxiety anymore.
Okay, real quick, webinar, time and place. Tell us about where people can learn more.
Yes. So March 23rd from 6 to 7:15 p.m., the staff at the Family Resource Center at the Institute of Living will be doing an informational meeting about anxiety disorders, treatment, and what loved ones can do to help them out.
All right, anxiety disorder information, great information. Dr. Scott Hannan, thank you so much for being with us.
Thank you for having me.